Let me give you some updates that we've gone through on the health side, as far as Commissioner Helen Carlton Harris will speak a little more specifically on it. We're up to 1,991 confirmed cases of COVID-19 coronavirus. I have to say, and we post it every day, and Helen's done a great job with and Billy Baker, my office, on the graphing, but we are starting to see a tendency now of graphing in the 30s, sometimes below the 30s, as you can see. So that is a positive trend that is occurring, and that's extremely important. On the homeless front, and again, I'm deeply appreciative of Bay State Health Systems, Dr. Mark Kerouac, the President and CEO, and Mercy Trinity, Dr. Robert Russo, Chief Medical Officer, who have partnered with the city to make on testing overall at other sites, expanded sites, but our homeless, our vulnerable population of the homeless, which we're always very concerned about. We also ventured out to the Salvation Army for testing. Mercy Trinity did that. All 47, we're very thankful, all 47 tested negative, which is good news. Again, with Bay State Medical Center, Bay State Health Systems, 131 at the Friends of the Homeless have all tested negative. The Springfield Rescue Mission, that's Mercy Trinity. The Taylor Street site, 37 out of 38 have tested negative. The Mill Street site, that we just finished that, all 32 tested negative. More good news with Mercy. Currently in our medical triage tenting area, we have 9 individuals there in the midst of quarantining. Some that were moved to the state hotel Echo Economic Inn, or Echo Inn in Northampton, which has since been closed down, and now moving back to Worcester. These individuals quarantined, and Helen can speak more specifically about it, but 3 refused to come back and 5 left, which is unfortunate, but the majority that did follow through negative testing has occurred. The deaths, and again, Commissioner Helen Carlton Harris will give more updates this week as she waits for the weekend numbers, but we're holding at 75 deaths pertaining to the city of Springfield, and God rest all their souls, and my sympathy, thoughts, prayers, and encouragement go out to the affected families. 44 are long-term care facilities, 31 are residential. Now, again, the spike in deaths as the state has reclassified a number of deaths to COVID-19 coronavirus that were previously under another guideline. Commissioner Helen Carlton Harris indicates to me from DPH that 98.5% of these individuals who have passed away, God rest their souls, had underlying health conditions. On donations, again, I just cannot say enough about our private and business sector stepping forward. When I made that call, it seems like forever now ago, but Sheriff Nick Kochi, who has been a great friend and great partner to myself and the city of Springfield, he has stepped forward, and he will be making masks for all our city employees, which is deeply appreciative, and I called and spoke with Sheriff Kochi last week to thank him. Mike's Beauty Supplies, which is right down the road here on Main Street, donated a big box full of PPEs for the city. We deeply appreciate that. And Mr. Hone Heo, Executive Director for On Community Child Care, which is right on Liberty Street, 750 KN95 masks were donated for police, our brave and dedicated police and firefighters and frontline personnel. So thank you to each and every one of those individuals for doing that. I really appreciated that. I was able to see firsthand, I visited Central High School late Friday morning, early afternoon, to see the Oasis Food Pantry at work, well-oiled machine with a big heart. Every Friday, we are servicing about nearly 3,500 families, so hundreds of thousands of meals and fresh fruit and food. And milk is going out there. I want to thank John Foley, Western Mass, the Food Bank of Western Massachusetts, Sedesco, Tad Tokar is the principal of Central High School. I want to thank DPW, Chris Signoli, Greg Superno for their efforts, Commissioner Clapper with the police department, Tony Calabrese, AC Produce. I can go on and on. I know I'm missing individuals, but all the volunteers. I was up there to hand out boxes of food, but mainly to thank all the volunteers that continue to be involved in that. And if I missed anybody, it's a mistake, as Mayor Sullivan, Billy Sullivan, used to say, a mistake of the head, not of the heart. But I just wanted to be out there to thank each and every one of them. It was very, very heartwarming. We are going after more PPEs. I've spoken to the state, MEMA, and Pat Carnevale, the governor, lieutenant governor. More PPEs. Shipment is coming with them. And I'm also working to secure about another 4,800 masks. I believe there'll be surgical type masks from the U.S. Conference of Mayors. Tom Ash represented me on the lieutenant governor's reopening conference call on Friday. And by the way, Lieutenant Governor Polito called me early Saturday morning to give me a preview on the reopening, and I know the governor, I believe, will be announcing more specifics, his specifics, I believe, at 11 o'clock today, so we'll try to go as quick as possible. Here I'll have a little more to say on that. I'm also glad that the Water and Sewer Commission has heeded my call. They're increasing that senior citizen discount, more than doubling it to $75 a year. It was $33, and they're also continuing to look to see how they can decrease that proposed rate hike, and that senior citizen discount is for disabled vets also, and they've expended late payments, any shut-offs, late fees, working out payment plans too, which I'm happy about. We understand the balancing act there of not wanting to have a Flint, Michigan occur here, and infrastructure improvements must occur, but they have to be reasonable, as has been in past years. So thank you on the Water and Sewer Commission, and we'll continue to see if they could press that rate hike down. With the unemployment trends, I asked my Chief Development Officer, Tim Sheehan, wanted to know the unemployment trends, specifically in the city of Springfield. We were able to get some statistics. Unemployment citywide it mirrors a lot of America, especially urban America, 30% citywide. 01105 is the highest, 36%. 01103 is right behind at 35.5%. The only neighborhood areas in the city of Springfield that are below 30% are Forest Park, East Forest Park, and 16 acres. So again, that is the delicate balancing act we have here to reopen using medical, health, and science guidelines, but we have to be cognizant that we do have to get our economy going and our people and businesses working again. On the finance aspect, my CFO, TJ Plan, indicates to me that now we've lost $3.2 million in revenue loss, and we've spent, again, $5.8 million of deficit spending, which, as we've done with past natural man-made disasters, I will not skimp on a dime for what our residents and business community need immediately, and then we will recoup and go after every dime of reimbursement, whether state or FEMA and the feds. The Springfield's allocation on the CARES Act is about $13.6 million. We're going to leverage that to make sure that we can finish out FY 20 and use what we can with FY 20 and FY 21, where we can balance off on other reimbursement aspects and really try to accumulate this money moving into FY21 and FY22, which will give us more flexibility to keep services and employment going. On the police side, Springfield Police Commissioner Cheryl Clapper indicates 7 down, 6 officers down, 1 civilian. Again, we are working toward a phased reopening with the clerk's office, and we'll have more to say about that in the middle of the week with LTCs and others by appointment. The masks have been going very well. Commissioner indicates to me only 1 warning had to go out, and we continue to hand out masks as supplies last. Mental health calls have gone up tremendously. We are now, B&H is our partner. We now have B&H individuals working Saturdays with our police officers too. In the meantime, you still have the nitwits that are out there. And I'm not going to mince any words. Narcotics continues to make outstanding raids. We took 2 loaded semi-automatic weapons and arrests of repeat violent offenders who were already arrested for prior gun arrests, but the courts let them out back in our streets and our neighborhoods. Absolutely disgusting. But they made those arrests on that, and hopefully our courts, judicial system, holds these individuals. But these are semi-automatic weapons, fully loaded on major narcotics raids, and other gun arrests have been made by the brave and dedicated men and women in blue. Training of body-worn cameras is starting this week. First 12 are going in. We appreciate that. And again, Commissioner Clapper is being as creative as possible with new cadets. We'll try to help out when we eventually reopen the lobby traffic so we can keep more and more police officers on the streets. Commissioner Calvi from the fire department, in pretty good shape. They're still down 4. It is EMS week, so thank you to all the EMS workers, and Commissioner Calvi will speak about that. He'll also speak about there was a massive explosion that occurred in Los Angeles, downtown Los Angeles, in which 11 Los Angeles Fire Department firefighters were, if you see the video, injured. Some really in tough situation. And you know how that occurred? And that's why I know with the legalization of marijuana, which is fine if you're following all the guidelines, that was from a hash oil vape shop, which is retail, but it was illegally manufacturing this hash oil, which caused that massive explosion. So you can see why the city of Springfield wants to be very, very careful as we move forward. We've already moved forward on medical marijuana, and we want to be very cautious as we move forward with retail marijuana. But that was a retail establishment that was backdooring manufacturing hash oil, and that was a massive explosion. 11 firefighters hurt. If you see that video, Godspeed to them all. Superintendent Dan Warwick will speak to you a little bit too. We're over 800,000 meals that have been served at 18 different sites throughout the city, including Central. Sedesco is now partnering with us at Oasis Food Pantry. Summer school, the superintendent and his staff, administration continue to work on a combination, whether something can be done in-house or remotely. Laptops will continue to stay out. And again, we're ahead of the curve on that. 17,000 laptops that we had already put out to our students. Superintendent, trying to do a balancing act. We have virtual graduations, but he's also working with the schools and the principals, an appointment to do staggered graduation at the school. Last day of school is June 19th. Tim Sheehan, my Chief Development Officer, all our HUD filed paperwork has been done and filed. And our grants and minorities, I think we're over 45% on that. And I think all the contractual agreements on our prime to pump the second phase should be done by the end of the week. I signed a number of them last week, and I know checks are starting to go out to keep our restaurants and small businesses going. Greg Superno is here with representing Chris Signoli, DPW. Operations continue to move forward. They're only down one. Trash continues to get picked up. Recycling, yard waste, construction, you'll see an uptick that'll be occurring on that. Pat Sullivan, Director of Facilities Management and Parks, done a great job with his team. Golf courses, we had good crowds on both golf courses. The parks are doing well. I know the Superintendent Sullivan, Director Sullivan, is very anxious to continue sprucing up the parks and the neighborhood areas, but we are down. Many times we partner with the sheriff's team, and we're down probably 100 there, but be patient. Aesthetic quality is important to Pat and myself. Pat continues to work really around the clock pertaining to the reopening of City Hall and city municipal buildings with graphics, tents on that. Ed Pakula will be reviewing the legal aspects of Governor Baker's reopening plan. We want to further specifically examine that, and we will have a specific announcement on our reopening plans. Most likely Wednesday morning will be much more specific. We put our foundation guidelines out. Attorney Bill Mahoney, my labor and HR director, continues to review as we're starting to roll out our policies and training for reopening of employees. And Memorial Day is coming up, so two things. Next week's press conference will not be done on Monday. We'll do it Tuesday. We'll do it Tuesday the 26th at 10:15. But probably even more importantly, we will honor our veterans who made the ultimate sacrifice to allow us to lead the lives we lead, whether good or bad. We will do a City Hall event, very limited on laying of the wreaths on Veterans Way in our Court Square and Veterans Way area, and we will do that. And I know that Veterans Director Tom Belton and Deputy Director Joey DeCaro are working with the cemeteries about laying an overall wreath. It's just very difficult. I know they flag all the cemeteries, but very, very difficult to do under the edicts we're dealing with on social distancing. But we are not going to forget our veterans. So I appreciate Director Tom Belton and Deputy Director Joey DeCaro, but we're going to make sure we honor our veterans. With that, again, I'm very, very pleased always to have the expertise here of Dr. Mark Kerouac, who is the President and CEO of Bay State Health Systems, and Dr. Robert Ruse, the Chief Medical Officer of Mercy Trinity Healthcare. And I want to thank Patrick Leonardo, who's always here from AMR. They have partnered with us too, and I appreciate that. So before I bring up Dr. Kerouac for his update, I want to thank each and every one of you, whether you're here or watching right now, and I want to thank the media, the print media, radio media, and TV media for continuing to get our information out. But I want to thank the residents and the business community. You've been very patient. You've been very, very understanding. There is light at the end of the tunnel. We just need to continue to follow some of the now, I don't want to say relaxed restrictions, but some of the reopening restrictions that need to be heeded. We want to make sure that we don't have any type of spikes. We are prepared because we worked hard in conjunction with our hospitals that, knock on wood, if a spike should come about, we'd be able to handle it. But we're hopeful that people will respect about wearing masks, will respect about the social distancing, will respect about the hand washing, which is extremely important. And if you don't feel well, stay home. So again, I just want to stress to you, even though the governor, and I commend the Governor Baker and Lieutenant Governor Polito and the whole review team, and we're going to work with the governor's edicts, and as we have, work hand in hand. The lights have not been completely turned on today. Got to be cognizant of that. We don't want to take one step forward without balancing the medical health, and sciences with economic reality the wrong way or too quickly, and then end up taking 2 steps backward. So a big shout out and a big thank you to all our residents of the City of Springfield and business community. And we're here to work hand in hand with you. I know with Director Sheehan, we're already starting to work with restaurants to do the al fresco, and DPW and the law department and police and fire for emergency access. But we're going to work hand in hand to move through these phases as quickly as possible. I know people will be very happy that they can go back to their houses of worship, or the churches, mosques, synagogues, following the guidelines. And I understand, and coming from a family of barbers and hairstylists, that soon each and every one of us will be able to get a trim, though I like my hair a little bit longer, following the social distancing and all the health requirements. So we're getting there. We're getting there, and as I said from the beginning, working together, we will get through this together as one and for the better. Now, from the medical expertise side, which is extremely important, and heed their calls, Dr. Kerouac will be coming up now, the President and CEO of Bay State Health Systems, Dr. Mark Kerouac. Thank you.
Well, good morning, everybody, and thank you, Mr. Mayor, again for holding these events, and thank you very much for the collaboration and your leadership, and working with your team has been a pleasure throughout all of this. I would tell you there's not an awful lot new in Bay State Health statistics. We've seen a continued downward trend both in our ICU cases as well as our overall cases. There was a little bit of a hump in the curve the weekend before last and early last week, but it's been steadily down, and we shouldn't take this for granted. We're now down below 80 for a few days across Bay State Health. Western Mass has done extremely well with this epidemic. And to give you a sense of how well, I took a look at the statistics from Worcester County. Now, Worcester County is a big county. It's got about 820,000 residents, roughly the same number of people that live in the 4 counties of Western Mass. Last weekend, they reported 237 hospitalized cases all across the county and 88 cases in their ICUs. We get together as a group of CEOs from the Western Mass hospitals, and Worcester has 3 times as many hospitalized cases and more than 4 times as many in the ICU. There may be a number of different reasons for this. Clearly, we do have less population density out here, but not that much less. I do believe that we jumped on the whole recommendations around social distancing earlier and more completely in this part of the state than in other parts of the state. And we were able to jump on some hot spots fairly early on to contain them, all the while keeping caregivers safe. So we shouldn't underestimate the work that everybody has done in terms of trying to contain this by cooperating and keeping solidarity around these guidelines. As the mayor mentioned today, the governor is announcing his reopening plan. We're one of at least 30 states now who've got plans out there. I was proud to serve on his 17-member reopening advisory board. I think it was a very good process. It was a diverse group of people that worked well together, heard from multiple stakeholders, and over 50 hours of Zoom meetings. I've become the king of Zoom meetings. Moving forward, as the mayor noted, is going to be based on some really key measures like overall inpatient cases across the state, deaths from COVID, and the percentage of positive tests. We want to see that number going down. And then finally, the ability of the hospitals to absorb a resurgence if one were to occur. And certainly all of us in Western Mass believe that together the Western Mass hospitals would be able to do that. Hopefully we won't have to. It will be a phased approach. They'll keep an eye on these numbers, wait a few weeks, allow a few low-risk industries and venues to come in, wait a few weeks, and then step by step get things back one at a time. I think that it's a very cautious plan, but it makes sense since Massachusetts was number 3 in the number of cases across the country. And so we really don't want to go backwards, and there's a long way to go to get things down to a really safe level. We know still, though, that we can't stay in lockdown because of the effects of a depressed economy, not only on the way we live our lives, but also on our health, too. So it really very much is a balancing act. And the plan's an attempt to keep the virus contained while gradually opening things back up. But it's not going to be the way things work. There's going to be a detailed rundown of everything, what's starting when, on mass.gov/reopening later today. In the next few days, though, we are going to start experiencing what it's like to be in this phase one. And some familiar businesses and venues are going to open up, but not the way we knew them before. We'll still be wearing masks. We'll still be doing the social distancing thing. There'll be a lot more disinfection going on. Oftentimes, things will have to be done by appointment, and there may be conscious efforts to lower the capacity of whatever business you're looking at. We'll be doing the same behaviors we do now, kind of like we do in grocery stores, for example, but extending them to a wider number of businesses that have been selected because we believe they're low risk. And if all goes well with the numbers, 3 or 4 weeks, they'll open up a whole nother set of businesses. And these, too, are going to look very different. We're still going to see a lot more working from home. We're still in the healthcare space. We will still see a lot more telehealth, which has turned out to be pretty popular, actually, with both patients and providers. For some of the other countries that opened up earlier than we did, even with the relaxed guidelines, it's not like it was before. There are far fewer crowds in the big cities. People are hesitant to come back. And there, even in a few countries that have done things well, have been some small outbreaks that have required vigorous testing and tracing to keep them contained. So I think this climbing back is going to take a long time, and even when we are all the way back, I think the world will be changed for a long, long time. As far as healthcare goes, our delivery of healthcare will be partly reopened for higher risk patients in this phase one time because we realize that deferring care carries its own risks for those patients. We're redesigning workflows and spaces to separate COVID and non-COVID patients and to rapidly diagnose people with suggestive symptoms so that people don't have to worry about putting off their routine care of non-COVID illnesses. And purely elective volumes will probably wait till a later phase. Also, as we're reopening, we're going to be growing rapidly our ability to test and trace contacts. Today, the system in our core lab does about 500 tests a day, but I'd be a lot happier if we were doing 5 times that many, so that we could have people without any symptoms at all who are concerned walk right in off the street without a doctor's note. We're not there yet, but that's the goal. I know the state would like to increase its testing tenfold. They're doing about 10,000 a day right now. They'd like to bump that up to 100,000, and they're applying to the federal government for some money to help support that. Contact tracing, of course, has to follow testing. That's been beefed up quite a bit here in Massachusetts, and in working with the local boards of health, I think has been a great enhancement. So if you are contacted about being in touch with somebody who may have had COVID, please take the call. Please listen to the advice. I wanted to say a word or two about the graduations. I took a look on TV at some of the virtual graduations that were going on across America, and I was really struck by the challenges of this latest generation, this Gen Z generation. These kids came to age after 9/11. They've had to put up with stuff like school shootings and climate change and growing income inequality, and now a pandemic and a depression all in one. Many of them feel that life is really not fair and that the system's rigged against them. And the pandemic certainly has exposed some of the problems of our fragmented health system. I do believe, though, that as we recover, we're going to start a series of conversations about who we want to be as a country going forward. Can we be more fair when it comes to giving everyone equal opportunity? I think these conversations are only going to intensify as the people who graduate this month begin to gain power and influence in our society. It'll be an interesting phenomenon to watch. We have not been as coordinated as many other countries in our response to this pandemic. A lot has been left up to the individual governors. It's been very much a patchwork across the country. I believe Governor Baker has done a good job, but even in other states where governors have really rushed to reopen, ordinary Americans are exercising their own judgment, as they always have, and that sort of sets us apart from many other countries that are more authoritarian, where people simply wait to be told what to do. We have a lot of debate about what the right thing is to do. We don't like being told by experts like me what to do. We take our involvement in civic life very seriously, and we like to hash out these issues, sometimes in very noisy ways, in the public square. Happily, though, most of us have chosen to listen to, consider, and decide to follow the expert advice, even in the states that are opening quickly, because we feel that first and foremost, we need to stop the spread of the virus if we're going to get out of this current mess. So again, I'm grateful to the efforts of all the people of Western Massachusetts who have blunted the effects of this pandemic through the sacrifices you've made and your careful adherence to the guideline. It's been a big part of our success so far. I promise that Bay State Health will continue to do our part in caring for those with the illness and offering complete and timely information about how we're doing. And I'm hopeful we'll all continue to follow the guidance even as we go through the reopening process around hand washing, social distancing, staying at home when you're sick, even as we begin to expand what we're able to do a little more than it was before. So thank you again for the opportunity, Mr. Mayor, and look forward to working with you still further.
Thank you, Dr. Kerouac. And I have to say, not because he's just spoken, he's here, and he's a good friend, in that conversation with Lieutenant Governor Polito, is how lucky we are to have you on there. And she had mentioned, you know, coming from a medical field, you think it'd be sort of weighed that way, how balanced you were about not only the medical and health and sciences, but getting the economy going again and doing it in a safe way. And she had specifically had mentioned that, and very, very appreciative. You had a busy schedule as it is to be doing that. Appreciate that, Dr. Kerouac. And speaking of that, I know I had a couple hours off time Saturday, and I like to plant flowers like my mom always did, and went to 16 Acres Garden Center. And it was working out very, very well there. Everybody had masks on. Everybody was social distancing. And they were so ecstatic to be back open again, and they've been there for 60, 70 years on that. So, and John McDonough, how's your mom doing, by the way? I just saw you there. She's good. Okay, very good. Another great medical official and expert, and they've been a great partner, as has Bay State, as Mercy, Trinity Healthcare System, and Dr. Robert Roos. Again, I appreciate he's here every Monday morning to give an update. So without further ado, the Chief Medical Officer of Mercy Trinity Healthcare, Dr. Robert Roos.
So good morning, and thank you, Mayor, and to your team for your continued leadership, transparency, focus on the community. It's exactly what we need right now. And thank you to the Western Massachusetts legislative delegation, as we continue to be grateful for your support throughout this pandemic as well. I hope everyone had a nice weekend and were able to enjoy the sunshine in a safe way. I myself was also thinking about graduations. I had the privilege to be able to attend a Zoom graduation over the weekend of a family member who is going to be a nurse after completing her education right here in Springfield at AIC. And I couldn't help but reflect that these graduations are coming at an interesting and very important time, where we are learning much more about the pandemic, where we are rapidly applying that information to what we've learned, and that all the new graduates in a variety of different fields are going to be putting their skills to the test in the near future at a time when it couldn't be more important. So we've been fortunate to have great collaborations and contributions from our local colleges and universities here, including AIC, Springfield College, STIC, Bay Path, Western New England University, and others. And on behalf of Mercy, just want to recognize the graduates who are the future leaders of our community as we learn from them and each other and move forward together. Our update at Mercy this morning is going to be relatively brief as we continue to move forward in a positive direction. In terms of our numbers at Mercy this morning, we have currently only 22 confirmed or suspected cases of COVID in our hospital, which is our lowest yet, and only 8 in our ICU. This represents 2 consecutive weeks where we've seen now declining numbers, with less than 25% of our inpatient medical cases with confirmed or suspected COVID, and less than 15% of our overall inpatient census. We've talked a lot over the last several weeks about how we've created COVID-free zones, how we have a COVID-free zone entrance, walkways, elevators, and an entire floor. Well, this week, we will actually be closing yet another COVID unit to convert now into a different COVID-free zone. At the peak of the pandemic, we were operating 3 full units outside of our ICU taking care of COVID patients, and by the end of this week, we will be down to just 1. It means that we have plenty of capacity, and we've implemented the safeguards and care to be able to care for patients with COVID and those without seamlessly and safely. In regards to testing, we've now tested over 8,713 individuals with 2,142 positives and 6,190 negatives. Our percentage of positive tests has also declined for 2 consecutive weeks, and as of this morning, it now is down to 12 to 15% over the last week. Again, another positive sign. We continue to test all patients coming to the hospital for any type of procedure, inductions of labor, C-sections, and others, and we're seeing extremely low numbers of positive tests. In fact, no positive tests in the last 3 weeks, which is a testament to the safe protocols in place, the enhanced screening, and a relatively overall low community prevalence of virologic infection. In regards to treatment, we continue to treat patients and see the positive results with the use of convalescent plasma. Several patients that have been treated with convalescent plasma that were critically ill have been moved off of ventilators and discharged from the hospital. And we continue to closely monitor other emerging treatments, as we've mentioned before. So for us at Mercy, it's clear our focus remains on safety as our top priority, recovery of both our patients and our community, and taking care of your health and well-being throughout. We continue to support our teams now in supporting their resilience, but we're also making preparations to be able to respond to any potential outbreak if it were to occur or emerge with a second wave in the fall or the winter. We are eager, just as you all are, to hear about the phased approach to reopening of the community. And I too want to thank Dr. Kerouac for being a voice for both public health and business here in Western Massachusetts throughout this pandemic and the process of reopening. As hospitals and healthcare institutions, we care about your health and your livelihood. We recognize that they are inextricably linked. What we do and how we make a living and how we connect with people and who we encounter are the things that matter in our lives. These are the things that give us meaning. These are the ways in which we support and preserve our ability to be well in many cases. And so while we don't want to see a resurgence of this deadly virus, and we must follow the public health procedures of hand hygiene, of social distancing, of wearing masks, and isolating when sick, we also don't want to see our community stalled for too long. And I think that there's reasons to be optimistic and confident that we will do this right. As I think about an example of that, I refer back to this Zoom graduation yesterday. There's no debating that these have been dark times. And despite not being able to graduate in a packed stadium in front of her colleagues and mentors and teachers, she walked across her parents' backyard lawn with cap and gown, dressed to the nines, to receive a substitute diploma. And she did it, proud, with her head held high, ready to take those important next steps. And on the top of her cap, which many graduates now do with an embroidery, she removed it, and on there she had embroidered, "Be the light in someone's darkness." And to me, it could not have been said better, or a more poignant message in this time. As we talk about reopening, we talk about emerging from a dark or challenging time. And at Mercy Medical Center and Trinity Health and for our community, it's about just that, emergence. A word that has its root in bringing light. It's about rising forth from the challenge and bringing light. It's about emerging stronger, more together, and more prosperous. And together in time, I know we will do that. Thank you.
Thank you, Dr. Roos. Very eloquent. Thank you, Dr. Roos. Very eloquent there. Billy Mahoney, got to call you Jesse James today, okay, with that mask. He went back to his cowboy days there. Give us a little levity. Commissioner Helen Carlton Harris, like all my cabinet heads and rank and file, she's really done a yeoman job being a point person. This is really a public health crisis and emergency with the pandemic, and she has been tested and true and steady and steadfast on, and she's going to give you an update. And as Dr. Roos had indicated, that there is some optimism here. We're going in the right direction, but we have to be ever cautious, ever cautious. Again, the lights have not been completely turned on yet. Hopefully very shortly in the near future. So you really need to heed the advice of a Dr. Kerouac, a Dr. Roos, and Health and Human Services Commissioner Helen Carlton Harris. Without further ado, Springfield Public Health and Human Service Commissioner Helen Carlton Harris.
Thank you, Mayor, and as always, thank you for your leadership. The Springfield Department of Health and Human Services is the Board of Health for the City of Springfield, and as such, the staff has done an amazing job of responding to this COVID-19 pandemic by doing the contact tracing. The positive results for the City of Springfield and all boards of health come through a system called MAVEN. They take those results and are in touch with our residents and also are doing contact tracing, and we're assisted by the Springfield Public School nurses and are now assisted by the CTC, the collaborative set up by the state. Our staff continues to answer your questions through our hotline, and we are very appreciative of the residents who call and ask questions. It's very important to us to know what you're thinking. We're also doing the inspections that you tell us about as far as businesses are concerned that may not be in compliance. So I am extremely grateful to the staff at the Springfield Department of Health and Human Services. As the mayor indicated, the positive cases in the city of Springfield are 1,991, and he did share with you the good news that on Friday there were 30 positives, on Saturday 39, and then on Sunday 32. While we would like to see that number go down, we are grateful to the fact that it is in the 30s. If you recall, I stood here and told you about a day where we had 104 positives. So City of Springfield and Western Region residents, you are doing what needs to be done, and you're listening to the scientists and to the expert. You are doing the non-pharmaceutical interventions that have been mentioned so often. The masks, the social distancing, the hand hygiene, staying home if you're sick, and just really doing the things that will keep all of us healthy, including the face covering. So I am so grateful to all of our residents. So congratulations goes out to you. Thank you very much. As we begin to open the Commonwealth of Massachusetts and the City of Springfield, this new normal will persist. We know that things will not be normal. We know that we are going to continue to have to guide ourselves through the non-pharmaceutical interventions. But there's one thing that has been mentioned that is important to know as we open up. Only you know your underlying conditions. Only you know, in some cases, your age. Only you know those things in your environment that put you at risk. So as we begin to take measures to open up, it's also important that you acknowledge and understand your personal growth and your personal power and who you are and how you can make choices and decisions for your own self and your health. Dr. Kerouac mentioned a bit of this. We have choices, and I'm asking you that even if something opens up where you're invited to go and you know that it's a risk for you or your family, please take that into consideration. People are very concerned and want us to reopen. We won't be able to hug, and I am a hugger. I love hugging, handshaking. We will not be handshaking. So it's important to recognize there'll be some differences in the way that we behave. One of those differences is this summer. This will be a summer like a summer we have never experienced. And parents, having a child during the summer is going to be extremely difficult in terms of how you have to manage a child's behavior. It is difficult. They're going to want to know, why can't I hug my friend? Why can't I have a play date? Why can't I go to my friend's house and spend the night? Changes are coming for our children, and I want all of us to be mindful that while we as adults have the ability to talk things through and think things through, many times our children are confused, they're feeling nervous, they're feeling anxious because this is new. In the summertime, they're used to going out and playing and having just a good time and enjoying themselves. This summer will be different. This summer will be a summer of making structural changes for mitigation, prevention, helping our children prevent from getting sick. It will be a summer of recovery for some of us. But I want us to think about our children because I think this is going to be very important in terms of their summer. So it's important to acknowledge that you have to listen to your children, please. Listen to your children intently. Pick up on the things that they are saying, their nonverbal responses. If they're acting anxious, is there some concern? Be in touch with your pediatricians. Also, be honest with your children. Tell them to the degree that you can what is going on and why you're asking them to make these sacrifices in a very child-friendly way. Also, tell them you want them to protect themselves and their friends, maybe grandparents and those in their environment that they love. We're doing this for Grandma. We're doing this for Aunt Jane. We're doing this so everyone in our family can stay healthy. Now, I watched the ABCs of COVID-19, which was a CNN special that was geared towards children, and it used the Sesame Street characters. I encourage you, if you have young children, to have them watch that. It really is very good, and it helps put them in the framework of being able to understand better. I certainly did when I watched it. It was important that I was able to see it, and I was able to internalize it as well. So it's also good for parents. So please think about webinars, think about things you can show your children. This will be a summer that will be very difficult and one that is going to be extremely different. The pandemic is not over. Although we are going to begin to open, and I'll be working with Ed Fakula, our city solicitor, we've looked at a little of the guidance today that was sent over The governor will make a more complete statement, but some of the advanced notices that they've sent to boards of health is that essential businesses already opening must self-certify and comply with standards by May 25th. Manufacturing, construction, retail, curbside pickup only, places of worship may be able to open, but only at 40% capacity. Firearm retailers and shooting ranges will open. On May 25th, laboratories, life sciences, offices will be limited to under 25% maximum capacity. We're still asking individuals to work from home. Car washes for exterior will open, and as the mayor said, hair salons and barbershops will be able to open, but by appointment only. Pet grooming will be able to open and certain outdoor activities. The governor in his statement will make a more comprehensive announcement, and there are other things that I'm sure he will be announcing. This is an unprecedented time. It's been stated over and over again. Please, the pandemic is not over, and we should not behave as if it is. I'm very proud of the residents I work with. You have done an amazing job, and I thank you. I'm going to end with our map to show the prevalence of the virus in the city as far as our neighborhoods are concerned. I will also tell you that while we're still seeing clusters, as I indicated, our numbers appear to be stabilizing. We want them to stay that way. Community spread is real. It is spreading. This virus is in our community. We're not able yet to do the asymptomatic testing that we'd like to do so we can better understand the prevalence. However, we are doing what we are being asked to do, and I hope that we will continue that. I'm going to move over to the map, but I also want to express my condolences to Judge Tina Page on the loss of her husband. And she is a wonderful judge for the Hampden County area, the second African-American woman to be appointed a judge in Superior Court. Our condolences go out to her. As I move over to our map, you guys like the map, don't you? I think I need a drum roll or something here next time. As I move over to our map. Okay, so here is our map, and as you can see, those areas that we continue to talk about are areas that we see a penetration of the virus. We are working very hard to work with residents in those areas. We're giving information, we're handing out information in different languages to individuals just to make sure we are reaching those individuals in our neighborhoods that we want to have the prevention and intervention messages. I am grateful to those community-based organizations who continue to work with us and the residents in their neighborhoods. As I said to you, the positive cases are 1,991. That is represented by 1,241 unique places in the city of Springfield. So while our map is growing, obviously, because we have increased cases, the prevalence of the virus appears to be, for the city of Springfield at least, being maintained. So we're doing some containment, and we want to continue that. Again, Mayor, thank you for your leadership. Thank you so much for working with the department and the support that you've given not only me, but the residents. Thank you.
Sharp outfit, and take a look at those shoes there, too. Helen, do you want your paperwork here?
Thank you.
Thanks, hon. I sent them to the team. Thank you.
You know what? I didn't say her husband's name. That's terrible. His name, Tina's husband, was Craig Granderson. And so I did not say that. Craig was a resident of the city of Springfield, born here, has an entire family that's made amazing contributions, as he did, to this city. So I should have said his name. I apologize.
No, thank you, Helen, and to the Honorable Judge Tina Page, my sympathy and condolences, sent a little note on. Craig used to be on the Pine Point Neighborhood Council and was always a gentleman on it, so we're very sorry, Tina, Judge Page, for your loss. On the public safety front, again, we will now have Springfield Police Commissioner Cheryl Claproot come up. And again, the police have a tough enough job as it is to do, and then dealing with this COVID-19 coronavirus. They are still out there, not only doing public relations, but making arrests of bad individuals. I stated earlier, repeat violent offenders. For what rhyme or reason, the courts let them back out, and it drives me nuts that they have these individuals on our streets in our neighborhoods. How many times do we have to arrest on serious offenses? Without further ado, Springfield Police Commissioner Cheryl Clapper.
Thank you, Mayor. Good morning. As mentioned, I'm down 6 officers and 1 civilian due to the COVID virus. As of today, we expect a couple more officers back in the middle of this week, so far so good. We are making plans to reopen a bit to the public. We will announce them as the city announces some more openings and how we're going to do it. For a new license to carry, there is a necessity to have your photo and fingerprints taken, so we are going to open the lobby certain days with an appointment to accomplish that. Everything else that we can possibly do online or by mail, we will do. We will have all the information for you on the city's website as it comes out, and there'll also be a number you can call if you need more information. And those things that we can do by mail, we'll be giving you the address probably on Wednesday also. There is an uptick, spike that we're concerned about in the calls for mental health. It's a difficult call for police officers to go on. We don't quite know what we're dealing with when we get there. We have had the assistance of a behavioral health network worker who has been going out with the officers on call. They are great. They have been busy. We added one on evenings, so we had one on days, we have one on evenings, and now we're adding one on Saturdays. They're a tremendous help to us. They can plug in the person's name, and if they have been seen before, they can give us that information which is necessary to end the call as peaceably as can possibly end. For the masks enforcement, we are still just one warning, and we've handed out numerous surgical masks, and most people and businesses are complying, so they've helped us out. We've been busy, as the mayor's indicated, with crime. 2 more semi-automatic weapons taken off the street Friday night. 2 subjects who were arrested, both violent past histories, firearms charges on both. Another weapon taken off the street on Berkshire Avenue, an arrest made. We're working hard on solving some of these major crimes, and we're going to get some assistance soon, I think, with a task force that we'll be assisting the DA with, and maybe get some of these prolific offenders off the street, and as the mayor indicated, maybe keep them off the street, especially as the summertime rolls around. 12 officers have been taken off the street, and they're into the body-worn camera training program. These are going to be your train-the-trainers. They're going to be the ones who will go to different shifts and different bureaus and instruct the officers on how to operate and work the body-worn cameras and explain the policy that goes with the body-worn cameras. They're coming at a good time, I think. We have always said that we welcome the body-worn cameras and having an officer's perspective on what has occurred. We welcome it. There was on Facebook over the weekend streaming, and people shared it, of an individual at the Springfield Plaza Stop and Shop parking lot for an indecent exposure. This got a lot of attention. I will tell you, he has been identified, and they are getting a warrant for him as we speak this morning. So that's about it as far as we're concerned. And again, all the information on how we're going to deal with the applications, the licenses that you need to come to the Springfield Police Department for, we'll make sure we get that out on Wednesday. Thank you, Mayor.
Thank you. Thank you, Commissioner Clapprood, and again, Commissioner Calvi, Fire Commissioner of Springfield Fire Department, will give an update. I know it's EMS week, and Patrick Leonardo, all the AMR and all the EMS people, we appreciate what you do and what fire does. They're still out there, besides public relations, fighting fires. So without further ado, the Fire Commissioner, City of Springfield, Bernard B.J. Calvi.
Good morning. Thank you, Mayor. At the Springfield Fire Department, we currently have 4 firefighters out with COVID-related issues. I expect 3 of them to come back to work this week. We've been receiving a lot of complaints at the fire department for outside burning over the past several weeks. With the weather getting nicer, people having fire pits outside, and we've been receiving a lot of complaints about that. I'd like to remind everybody that outside burning is illegal in the city of Springfield. There is no carve-outs for anything except cooking outside. So fire pits and outside burning of yard material are illegal in the city of Springfield. I'd like everybody to keep that in mind. This is EMS week. This is the National Week of Recognition for emergency medical responders. I'd like to thank everybody on the Springfield Fire Department and our partners at AMR, and congratulate them and wish them a happy EMS week this week. I'd also like to thank Aerial Imaging of Agawam, Mr. Stephen Roth. They donated several mask spreaders to the department. We're testing them out right now to see if how they're working. And these are used to take the weight of the masks off your ears so you don't end up looking like Spock as you walk around. So we're testing those out. We've got a few of them out right now, and we're going to continue to test those. The last thing I'm going to speak about is in the city of Los Angeles over the weekend, there was a fire in the downtown area where 11 firefighters were injured. These firefighters showed up on scene. They had smoke showing. They made an aggressive interior attack and were quickly driven out of the building and off the roof when the building developed a huge fireball, flashed over, and had a small explosion. This was due to butane being stored inside the building. It was a smoke shop, and it's believed that they were trying to manufacture or had the products on hand to manufacture hash oil. I've spoken about this several times during the licensing process for marijuana facilities in the city of Springfield. And whether you're a licensed facility or you're trying to do this at home, hash oil is a very dangerous substance. It's made by leaching butane through the marijuana product and then evaporating off the butane and drying the product. That creates an explosive mixture. There's been several incidents in the Commonwealth of Massachusetts where people have blown their houses off the foundation, blown up refrigerators, and actually had fires at their houses. If you're attempting to do this in the city of Springfield, do not do it. It is a highly illegal and dangerous process, and I'm just asking everybody, if you have quantities of butane, please discard them. Let us know you have them. It's just a catastrophic event when the butane is released in a fire situation, and I'm just asking everybody to remain cognizant of that issue, and please do not do it. That's all I have for this week. I'll have more as the week goes on about the reopening of certain things at the fire department with permitting and inspections. Thank you very much.
Thank you, Commissioner Calvi. Appreciate that. From the school side, Superintendent Dan Warwick is here, and he and his team, they've done a tremendous job to keep things going and moving forward. So without further ado, Springfield Superintendent of Schools, Daniel Warwick.
Thank you, Mayor. Good morning, everyone. As of today, we're going to have served over 800,000 meals from our 17 school sites. We've added Central on Fridays only to go work in conjunction with the other programs that the mayor has set up there. So that's been a huge success. I want to congratulate my team, Pat Roach and the business office team, and our partner Sodexo for their great work on that. Those sites are going to remain open, and please remember we have 17 sites, one located in every neighborhood throughout the city. And on Friday, we serve meals for the entire weekend for families. So that's been a huge success, and again, great job to the staff on that. We're hitting graduation season, as was alluded to earlier. Our team has planned a remote graduation, working in collaboration with Focus Springfield for all of our high schools. The first 2 weeks of June, we're going to have those remote graduations airing live on Focus Springfield, plus we're going to stream those graduations as well out. So that's going to be a new experience for us, but very, very important that this senior year for our students is a significant rite of passage, that we offer a quality graduation. In addition to that, and I really appreciate my principal's efforts on this, we're planning a live experience for every student where they're going to be allowed to go to their school in their cap and gown, pick up their diploma, and have a stage-like experience with a diploma in response to a lot of our students and their parents' requests for that. So we're going to offer it both. We've worked to make sure that it's safe. Again, when we were looking at putting this graduation experience together, the safety piece was also very important. So we're working on that. That'll happen after the remote graduation occurs. Again, that's going to be televised. We're continuing our remote learning. The mayor, the education mayor, Dominic Sarno, has helped us. We had a one-to-one computer program for students in grades 3 to 12, 2 to 1, and K to 2. We bought all the computers now for K to 2, in addition to the other computers. So again, any family who still has not availed themselves of picking up a computer, or we can actually deliver it to their home, please contact their school, and we'll be able to deliver those computers. Our entire staff is working on a remote learning piece for all of our students and staying in contact with the families. Relative to the mental health issues that Cheryl alerted to earlier, our counseling team, our psychologists are reaching out to families who have needs. So again, anyone who has a need in that arena, please contact the school, and the principals can put you in touch with staff. Summer programming, we're going to expand our summer programming this year. The kids have clearly missed some due to the time it took us to get the remote learning up, and every family hasn't been able to fully engage yet. So we're going to expand our summer school. We're planning a significant summer school for all of our students. We're going to put activities out through their school. And again, we're going to use the technology and provide a significant remote experience for everybody. Schools are scheduled to close June 19th, so they'll close down June 19th. But again, we'll be opening up a summer school, and most of it probably being remote. We'll open up a small live summer school program if we're able to. Thank you, Mayor.
Thank you, Superintendent Warwick. Again, as I always say, Springfield's in the business of business, and Chief Development Officer Tim Sheehan and his team done a great job. We're, the Prime the Pump, we're one of the first, I believe one of the first out of Western Mass, one of the first estate, $750,000 out. A lot of those checks have already gone out, obviously, in the first round, and some will start going out in the second round. And if we are able to get our hands on a third pot of money, Director Sheen has a plan for those businesses that were not able to open but have to reopen under the new normal to do that. I'm proud on our outreach. Nearly 50% of the grants that have gone out have been minority oriented on it. And Tim will work with the rest of the cabinet heads as the governor's edicts, and we're going to work hand in hand with the governor, come out for how restaurants can reopen on the first phase al fresco. So without further ado, the Chief Development Officer of the City of Springfield, Tim Sheehan.
Thank you, Mayor. Just a quick update with regards to the CARES Act. All of the public participation with regards to the action plans associated with spending down that money has been completed, and the paperwork has been submitted to HUD. We're anticipating that there'll be a quick review of that, and ultimately that funding will be made available to the city to do additional programming in response to the coronavirus. As the mayor indicated, we are still contracting with businesses for the second round of Prime the Pump. As far as it stands right now with businesses that have been contracted, roughly 45% overall in phases 1 and 2 represent minority businesses. We're very focused on ensuring that there's been minority participation in the grant program. We think that is, in terms of the grant, it needs to be reflective of the business community, the makeup of the business community in Springfield. And finally, we are reaching out to businesses to understand what their needs are as we enter into the reopening phase going forward over the next weeks and months to come. Thank you.
Thank you, Director Sheehan. Pat Sullivan, my Director of Facilities and Superintendent of Parks, wears many hats. His team has done a great job at the parks. The golf courses are starting to move forward, evolution occurring there. The reopening, Pat is really heading that up. The tenting that's going to go up, the temperature takings, physical plant changes are occurring in all our city buildings with plexiglass and the masks, the gloves, the plastic face shields. We want to get open to the public as soon as we can in a safe, healthy way. He'll speak of that. Also, hearing Helen out with children, young kids, or even adolescents or teenagers or young adults. Long, hot summer. And Pat, we're going to try to figure out a way. Pat, Commissioner Helen Carlton-Harris speaking with Dr. Kerouac and Dr. Arnstein about the best way of waterways. Are we able to do sprayscape structured? Are we able to do pools because of chlorine in a structured aspect? And we're going to look to try to bring relief in a public health and safe way. But without further ado, the Director of Facilities and Park Superintendent Patrick Sullivan, the Wizard of Oz.
Thank you, Mayor. First, I'd like to, as a resident of the city, I just want to thank both our hospitals for all that you've done for our community in keeping us all safe. And I think under the mayor's leadership with Helen, we've kept our numbers low. So thank you for being there always when we need you in times of need. We are anxiously awaiting the governor's guidance as we look forward to taking the next steps. So I don't have a lot of updates for you today other than we have started preparing our public buildings. We have graphics going in throughout the buildings, both here, Tapley Street, and the police department. I want to thank Sheriff Kochi. He's making masks for our employees to wear, and that's saving the city about $6,000 for him making those masks. And then after we review the governor's guidelines, hopefully by Wednesday morning, we'll have some good information for you. But as Helen indicated, it's going to be a very difficult summer. We understand that. And I think as we read the different guidance from CDC, it's very hard to determine how do you still say social distance to be running recreation programs, opening pools, and so forth. So there's a lot to still be figured out over the next few days, but we are going to work hard and keep everyone's needs in mind, but also we have to keep in mind the protection that needs to be taking place. So we look forward to your continued cooperation and understanding as we all navigate through this process. Thank you.
Thank you, Director Sullivan. We're also, the farmers markets, Pat is looking into a way on that. Again, as long as we can do it in a safe, healthy environment, we're going to try to get this sense of new normalcy as quickly as possible, and then finally to normalcy once hopefully a vaccine has been developed. You had a DPW update. I don't know if Greg has anything else to add. Eddie on the legal, or Billy Mahoney, they're all set there. So what we're going to do is, as I've always done, is to first have any questions directed to Dr. Kerouac, the President and CEO of Bay State Health Systems, and Dr. Robert Roos, the Chief Medical Officer of Mercy Trinity Healthcare first, because they have to get back to their duties. So any questions or comments from the press entourage here, direct them please again to Dr. Kerouac or Dr. Roos.
I've got a question for Dr. Kerouac. As a member of the advisory board that Lisa put forth today, people who say we're going too fast in reopening, there are others who are saying we're going too slow. What's your take on this? Are we Goldilocks, is it just right, or what?
So the question is too fast, too slow, or just right? I think that is going to fill the airwaves and newspapers for days, whether we went too fast or too slow. And because we have so many different states doing so many different things, we're going to find out. I think that my gut right now tells me this is about right, given the amount of disease burden we were dealing with, and the phasing approach of taking low-risk industries first, waiting to see if the numbers change. This is not like reopening Vermont, let's say, or Wyoming, or someplace where there's been a very low disease burden. We were the number 3 state. Now, you could, it's possible 6 months from now we're going to learn that Georgia and Texas had it right, and just letting her rip was the way to go. But I think that's an awfully risky proposition right now.
Are there specific metrics that are spelled out in your report that move from phase to phase?
Yes, those were developed by the Department of Public Health and Health and Human Services with review by the advisory board. And there's going to be a dashboard of specific metrics. So it's no one measure, but a set of measures along the lines of what I mentioned. In-hospital cases, ICU cases, headroom in terms of hospital capacity, declining numbers of positive tests, deaths from COVID, et cetera.
And has the next phase been determined what will be allowed to reopen when we get to, I forget what it's called, whatever?
Phase 2, it would be, yeah, there are little subunits of phase 1 week by week, but phase 2, there are, a list of things that'll be published on that mass.gov reopening webpage later today.
Any other questions of Dr. Caroline? Matt?
In terms of your health system, and I suppose that doctors can answer this as well, are you confident that you will be nimble enough that there is some type of switch when you talk about reducing some of the wards that you have right now that are dedicated to COVID-related purposes? I know MGH is starting to do this as well.
Yeah.
Are you confident in being able to snap back? I mean, not necessarily like a catastrophe, but something that might require a little more capacity than
Right.
what you have at any given moment.
So the question about are we comfortable that we're going to be able to care for COVID and non-COVID patients in the same institution? And I'll invite Dr. Roos to chime in as well. We're doing it today. We have 80-some COVID patients in the hospital and about 350 non-COVID patients. We're testing every single patient on the way in, even a mom having a baby or a person who's having cancer surgery, just so we know that we don't get surprised that they turn out being a quiet carrier of COVID. And that's part of the segregation strategy here. I would say that we're doing it today, and I have complete confidence that we'll be able to expand it along the lines of the guidelines.
And I just to add to that a little bit, so I mentioned that we have 6 med-surg units and intermediate care units outside of the ICU at Mercy, and when at the peak of the pandemic, we had 3 of those units being dedicated to COVID patients, and now we're going to be down to 1. But all throughout that time, there was significant additional volume that could be expanded into. For example, we had a unit that weren't even open at all. We had additional units that were completely closed to either COVID or non-COVID patients. So I have no concerns that if we were going to see more of a surge, that we could very nimbly and easily, have enough space for both types of patients.
Just one other follow-up in terms of this kind of reopening question as well. Is there, I don't want to say that people are hysterical when they say that cases are going to shoot up just as we reopen, but I don't know if you can speak to a little bit of the severity of what kind of increase in cases you're expecting, or is there even some thought that this is done right? We'll see no significant.
So how much of a surge of non-COVID stuff do we expect? I would say we're starting to see that kind of leak in already today. We were allowed in the original governor's guidelines some discretion with respect to the practicing doctor, and we asked our physicians, If you think this case is not going to be any worse off for waiting 2 months, then please do. And now we see people coming back and saying, this person will be worse off if they wait much longer, and therefore we think it's time for them to go. And so, you can't simply hit the pause button on some of these diseases. They naturally progress. And many of them are serious enough to have gotten somebody in the hospital to begin with, but even something which you would think of as elective. I heard from one of our orthopedic surgeons that the patient was who was ready to have a joint replacement had gotten to the point where they had pain from bone-on-bone arthritis and were unable to walk anymore, and therefore would get deconditioned to the point where if they waited another month, the result of the joint replacement would be worse, a worse event. And so I think the physicians have exercised good judgment in knowing what can go and what can't. Right now, the guidance that we're looking for from the governor is something that is called priority prevention. So the example I gave, a woman awaiting a routine mammogram would still probably have to wait, but a woman who had a strong family history might be brought in for that. So they'll be making those kind of gray zone calls going forward.
But specifically to the increase in COVID cases as we reopen, there's some, and some sense you get from some social media or people that are responding to it that as soon as we start reopening, things are going to explode.
I don't believe that for a minute.
So to this kind of fear of, if we do this right, there's no reason.
Yeah, I don't believe that. I think if we basically shot the starting gun and the mayor declared a parade down Main Street, and we all decided to go to big crowded events, then we might see an explosion. That's what happened in the flu epidemic of 1918. But we're really taking baby steps here. We're talking you can't even go into a retail establishment. It's curbside delivery. There are no restaurants, no bars. Houses of worship have to follow guidelines of separation. I mean, this is nothing like back to normal. And so will there be little hot spots that pop up from time to time? It's possible. We've seen a few of those. There was a large retail store in Worcester County that had, I think about 80 of its workers got infected. And that's always a risk, but the ability of the health system to sort of jump on that, test and contain and contact trace is going to be the key to keeping the forward momentum about this reopening.
Any other questions for Dr. Caroline, Dr. Woods? Hey, gentlemen, thank you very, very much.
Thank you, Mayor.
I'll be talking to you, and then we'll next week, Tuesday, we'll do it Tuesday.
Very good.
All right.
Have a good Memorial Day.
Thank you.
Thank you.
Matt, you mentioned about social media. Social media, again, with blog many times, is sensationalism. And you got to say sensational things to grab headlines and conspiracy theories, but I think we've taken a very prudent approach. But it's right, because people will read that, sometimes without any underlying facts, and they'll be alarmed. But working with Governor Baker and Lieutenant Governor Polito, who I think have done a very, very good job, and our team here about, I've always said, I wanted to be able to open up yesterday, but we have to balance the medical, health, sciences with the economic reality. So I hope hope we're wrong, but if there is a spike, we believe in working daily with our hospital system, we'd be able to handle that. But if you can get out there into the media again, we're moving forward, cautiously optimistic. But all the lights have not been turned on today. So we got to continue to follow the public health guidelines. That's extremely important as we continue to starve and defeat this COVID-19 coronavirus. Any questions of my cabinet heads, Paul?
Mayor, are you planning to keep the emergency declaration in place in Springfield?
Yes, I will, because to make sure that we are in line to receive every dime I can get my hands on from the, if you don't mind, I'm going to take this off for a second, from the federal government, FEMA, and that's extremely important. I declared very early on, from past experiences in dealing with the EF3 tornado of June 1st, 2011. We're coming up to the 9th anniversary, which will have our houses of worship toll their bells in remembrance, and we'll be coming up to the 8th anniversary, Kevin Ambrose being killed saving a mom and a daughter, June 4th, but the freak nor'easter, the gas explosion the following year. It's been TJ Plant and the finance team and Eddie Pakula, everybody working together, cabinet heads. We track everything, so we're trying to leverage as much money as we can. But didn't skimp before, I'm not going to skimp now. We're going to do whatever it takes for the residents and the business community here in the city of Springfield. So we've had a winning track record on that. So we're going to continue to keep that emergency declaration. That also gives a lot of, not only to myself, but this is, as far as I'm concerned, this is a public health crisis. And there's a lot of power that will continue to be wielded by Commissioner of Health and Human Services, Helen Carlton-Harris. We want to be fair and we want to be compassionate, but if we have to come down with a hammer, we will. We will on that. So yeah, we're going to continue that because we have to track any and all expenses.
I just had a question for Commissioner Clappy about the body cameras, just a clarification on what you said, Commissioner.
Yeah.
Are the body cameras actually going to be used by officers out on the street starting this week?
No, yeah, we're in touch with the company, GTAC, and what we're doing is we're training 12 officers, and these 12 were in the original testing phase, so it shouldn't take much to get them up to snuff with what we got. We'll train them, and then they will train a certain amount of officers on each shift, the shifts that go out and the bureaus, so that sometime by July, they should all be up and running, and there's 511 of them. So most officers will be wearing a body camera.
So everybody will be trained before you actually send people out. So all of the officers will then start using body cameras at the same time out on the street.
Correct.
So you have a phased rollout where some will have them and some won't.
No, the some will have them and some won't. Will be training phases only, not the actual turn on the switch for the cameras. When we do that, everybody will be trained.
So you're starting training this week?
Yes.
Okay, great, thank you.
Yeah.
Matt, any questions for Commissioner Clapper? Matt? Sure. Yeah.
There's been some reporting in the Boston area about confusion about the opening date for some places that may open, thinking that today really is the day or tomorrow is the day or something like that. I don't know if you have any preparations or concerns about how to address that if some business, opens mistakenly, or if there's been any particular monitoring.
That's the point we've been trying to make. Well, I just, and Helena, that's the point we were trying to make about the 18th is the governor's and lieutenant governor's panel on giving the edicts. Some were already open, but if you looked at it, I think Helen will speak a little more, it was phased in certain dates, and he's given more specifics, which we're going to be going through with a fine-tooth comb with Solicitor Pakula and all my cabinet heads. Some have to also prepare, making sure they have the proper PPEs, the proper cleaning supplies, some with the retraining of their employees. So that's my comment. I appreciate you bringing it up, Matt. I'm going to bring Helen up. But that it doesn't snap. It doesn't snap. The 18th, everything's open. Go right out there. That's not so right now. There's restrictions. Helen, why don't you? Helen, you want to come up? Helen, you want to come up here? Or that way.
Well, yes, but also, we were thinking about places that might open mistakenly nonetheless, and what response there might be to places that might be jumping the gun because there was some confusion.
So we are waiting for the governor's guidance. We do have some preliminary guidance that I read to you in terms of those businesses that might be opening. I think what you're asking about is enforcement. If a building, a business opens and they're not in that category that is supposed to reopen based on the guidance, what is the enforcement we can do? So the boards of health do have the ability to go into those businesses and advise them that they are not scheduled to reopen based on the governor's guidance. Now, you might imagine that enforcement is going to be the most difficult part of our reopening phase. It was very easy to close down, a lot harder to reopen, and so we will be enforcing the governor's guidance. The governor's guidance does speak to a process in terms of communicating with businesses around their reopening plans and how they must do that.
Do you also, is there also going to be like, there isn't necessarily going to be a camera coming down when people might have mistakenly open as opposed to maybe 2 weeks ago where somebody was like, screw it, I'm just going to do what I want, correct?
No, we expect that we're probably going to get a cooperation from our businesses. We do not anticipate being a hammer-down enforcement entity. That is not why we want to do this. Our goal really is, from a public health perspective, to assure that our residents and community are safe. We know that this is a highly contagious virus. The businesses know that as well. While they want to reopen, they also want to be safe, and they want their workers to be safe. So we expect compliance, and further guidance will be communicated through the governor's guidance.
Matt, just to let you know too, Helen pointed out, and we've said it, I think, the last month or so, or last 3 weeks, confidence. And any business or establishments, 3 things. You want to make sure that you have that public confidence, the business confidence, and consumer confidence. If you don't have that trifecta, people are not going to feel comfortable. Now, I believe the governor is already on, so I could say a couple things now. Enforcement always trickles down to the local level, but I was very happy in conversations with Lieutenant Governor Polito early Saturday morning, about they're going to have an ombudsman. So someone, he or she, is going to be the clearinghouse first on these, maybe if anything is questionable, that you can be opened, you can't be open, or you have to be open on these certain guidelines and requirements. And that would lead to, and it's been pretty good, I got to tell you, Helen's worked in conjunction with Commissioner Clapper, with Cheryl, and we've only really had a handful where we really had to send a strong message. Other than that, everybody's complied. We try to educate first, as we've done with the masks, which you have not seen really any confrontations that you viewed on video across the country of takedowns occurring. So that ombudsman will be key. They do say, Helen had mentioned too about self-following or self-reporting. That's why we put out, Eddie, come on up. That's why we put out our specific guidelines, pre-guidelines, and now we'll tweak them once my cabinet heads look at them all with legal, with Solicitor Pakula and Attorney Mahoney, and then we're going to specifically tweak how we reopen city businesses, city business or city hall, municipal buildings in a safe and healthy way. And then in turn, we'll look at our libraries. We'll look at our senior centers. That's important for our seniors. They need the camaraderie. How is that going to be done on that? We're looking at our summer programs to see what can or cannot be done. And we want to make sure all these steps we've taken, and I hope we don't jinx ourselves here, we've been able to pretty much protect and preserve our workforce. And we're going to continue to do that. And once we start opening up City Hall, maybe it's going to probably be via appointment. People have to be patient. You're going to get temperature take. Every morning when I come in, temperature take, we have our masks on, a tent will be set up outside. All the other buildings that will be open technically on appointment basis, you're going to have to follow these guidelines. There's going to be different routes to get in and out of buildings. Elevators, one person, maybe 2 if it's the same family. So this all changes, but maybe Ed can expound a little bit. We're now going to finally get, again, I was able to get a sneak preview verbally from the Lieutenant Governor early Saturday morning, which I appreciate. But we have to look at the specific guidelines. So technically, Pat, I think we are going to try to do something. We'll know Wednesday. We'll make an announcement, probably sometime, whether Wednesday morning or early afternoon. on the 26th, that we're going to try to, in a phased-in way, certain aspects of city business will be a little more accessible. City Solicitor Ed Pakula.
Sure. Thank you, Mayor. While we've been holding this press conference, the governor has come out and indicated that the essential businesses that are open will remain open, that they will have manufacturing, construction reopening, that retail curbside pickup will be allowed, that places of worship with a 40% occupancy will be allowed, and firearm retailers and shooting ranges will be allowed as of today. On the 25th, as I understand the guidance, laboratories and life science facilities will be allowed to open. Offices limited to less than 25% maximum occupancy will be allowed, but work from home is still strongly recommended, and apparently Boston office openings will be delayed till June 1st. Car washes for exterior and self-service only will be allowed beginning May 25th. Hair salons, barber shops by appointment only allowed May 25th. Pet grooming by appointment, curbside drop-off and pickup allowed, and certain outdoor recreational facilities and activities. So that's the latest from the governor. I would just like to mention on the enforcement efforts, it's our goal not to punish anybody during these times. It's to educate and promote compliance to best practices and standards. And so our first effort in any situation, and we've been successful, has been just verbal communication and consultation when we see something that appears to be contrary to standards. And where needed, we've tried to offer some written redirection, so far it hasn't been an issue, but fines up to the $300 limit per occurrence can be there. And if all those don't work, then we'll go to the cease and desist letter. We have not had to go to court even once for anyone. We've been successful in using those methods of education and promoting compliance, and that has been successful so far. If we have to, we'll go to court. But we're not looking to shut anybody down. We're looking to help people stay safe and get the economy going again.
And all the guys are curious, with the courts having been kind of shut down in general, now we're running under a limited level, has there been any impact on what the city's legal operations have been? We just haven't heard from you on it, so I'm just curious if there's been any impact on your ability to, defend the city or sue for things the city needs, or any other, litigation elements that have been interrupted as a result of the outbreak?
Yeah, so we've had a lot of court hearings continued. We've been doing some court hearings by Zoom. We've been doing court hearings by telephone conference. At some point with Hampden County Courthouse being shut down, we've talked with the judges to have the availability to use Holyoke District Court. The coordination really has been primarily with the police department and their efforts involving criminal. From a civil standpoint, everything has pretty much been on hold, and it's just starting to get going again. The first things are going to be bench trials, and the latest that we've heard from the SJC is jury trials probably won't start up again until September. And of course, those will begin, of course, with the criminal side, but on the civil side, we're not sure exactly how that's going to play out. And we're still working. There's a lot of education going on, and we're trying to educate ourselves how to better use some of the technology to conduct depositions remotely, and other use of technology. The law department, we have divided up into 3 different offices. We've had an A team and a B team with schedules being basically a Monday, Wednesday, Tuesday, Thursday, alternating Friday schedules. We have been able, with the help of our IT department, to get laptops for everyone to work at home, and work has continued. I have to tell you, I've been busier than ever, but the entire cabinet, I think, has been. I know the mayor talks about the lights being not coming on. They've been on here. The lights have been on. It may be closed for the public, but everyone here has been working day or night, and sometimes both.
Can I just hot off the press, let me just take this off for a second, if you don't mind. Thank you, my communications director, Billy Baker. Eddie, thank you very much. Just hot off, this is what has come out now in formal writing from the governor. All these businesses, I'll just quickly, currently have been allowed. All businesses deemed essential, previous order, currently allowed, but then have to follow the May 25th best practices and protocols. This includes real estate open houses, currently allowed with restrictions. Dog walkers, currently allowed, but again, all May 25th protocols and practices. Banks currently allowed, but the protocols, best practices of May 25th. Financial services, same thing. House services such as nannies, babysitting, house cleaning, currently allowed, but again, they'll be following now protocols, best practices of May 25th. Construction, phase 1, May 18th. We had many construction projects continuing to go on here in the city of Springfield, unlike other areas of the state. And just even more specific, now manufacturing, again, is phase 1. They want you to refer to the new guidelines. That was May 18th. Places of worship, phase 1, May 18th. Refer to the guidance, which has already been elaborated. Hair salons and barbershops, May 25th. And you have to refer to the detailed guidance and protocols. Car washes, the same. You heard about that, May 25th. Pet grooming, May 25th. Same thing, new protocols and guidelines. Retail, such as clothing stores, toy stores, jewelry stores, nurseries, and garden centers. I was at 16 Acres Garden Center, as I indicated, this past Saturday, that don't sell food products. Adult use cannabis stores, phase 1, May 25th, for curbside pickup and delivery only. Phase 2, which is down the road, is browsing inside the store with restrictions, but it's only phase 1 now. General office spaces, and again, the lights are on here, but we're going to continue on staggered type workforce aspects, remote aspects on it, but we're going to stagger it because we want to preserve our workforce. May 18th, except the city of Boston. They're not opening. The city of Boston will open or start a phase-in process. Marty, Mayor Walsh, June 1st. We're open. We're going to continue to move forward within reason. Lab space, phase 1, May 25th. Got to follow the guidelines. Gun stores is not applicable. The court ordered them open. Libraries, and this is for Helen Colton Harris and Molly Fogarty. Phase 1, May 25th. Again, we're going to put out our own for curbside pickup delivery only. Phase 2, you might be able to consider browsing inside with restrictions. Auto dealers and wholesalers. Phase 1, May 25th, for curbside pickup delivery only. Got to follow the guidelines, obviously. Phase 2, down the road, browsing inside with restrictions. Restaurants, phase 1, can continue to offer takeout and delivery options. We are currently actively considering additional guidance to provide restaurants before phase 2, and that would be the opening dining areas, which we're looking to move forward to al fresco outside. Drive-in movie theaters, phase 1, May 25th. Business must follow mandatory workplace safety standards. In-home installations, for all the viewers out there. May 18th, construction related. Phase 2, non-construction related, so construction related, painting, repairs, etc. Non-construction related, carpet installation, home theaters, and security systems. Again, following the guidelines. That is phase 2, though. That's phase 2. Category, okay, hotels, accommodations, including short-term private vacation rentals by owner. Currently open to provide services to essential workers and vulnerable populations. So what we have been doing for first responders, homeless type aspects. They are actively considering whether additional guidance to be provided for some type of consideration for phase 2. So if they do open, it'd be phase 2, reopen, and it'll be to serve other guests with specific restrictions. Other personal services such as nail salons, Helen, day spas, massage therapy, tattoo parlors, which we have some control over, is phase 2. Phase 2. So they're not reopening as of phase 1. They're not reopening at this point in time. Casinos, which we had thought, hotels, restaurants, phase 2, gaming area, phase 3, theaters, arenas, possibly phase 3, phase 4, casinos, hotels attached to them should follow guidelines for each section property, example, hotels, restaurants. Bars, phase 3 possibility, phase 3. Bars are defined as establishment that only serves alcohol, do not have kitchen areas that prepare food on site. So that's phase 3, that's down the road. Museums, phase 3. Movie theaters, phase 3. Gym and fitness studios, phase 3. They're evaluating currently to see if opening on personal training on an outdoor class. Again, that's phase 3. Amusement parks, to be determined, but at the earliest, that's phase 3, most likely phase 4. Large venues, such as arenas, stadiums, nightclubs, or other sports venues, phase 4. Phase 4. There's a process that's going to go on that qualifies what is a large venue. Driving schools, to be determined. It's not in phase 1. The RMV has to have a comprehensive plan is being developed there. Flight schools, to be determined, not in phase 1. A comprehensive plan is being determined. And finally, recreation and outdoors. Golf, currently allowed with restriction, continuing to follow the outlined essential services facts, answers, and questions. Beaches, currently allowed for transitory activity only, will reopen more activities in phase 1, May 25th. Please refer to the detailed guidance and reopening. So that's May 25th. Parks, currently open, but services and facilities will reopen phase 1, May 25th. You have to refer to the guidelines and details, and we'll be more specific on ours. And then finally, fishing, hunting, and boating, phase 1, May 25th, refer to the guidance. Outdoor gardens, zoos, reserves, public installations, phase 1, May 25th, refer to the guidance. Outdoor adventure activities, including ski areas, summer activities, zip lines, mountain biking, phase 1, May 25th, but you have to follow the detailed requirements. Outdoor performances, maybe in phase 2. Tours, phase 3. Sightseeing such as bus tours, duck boat tours, harbor cruises, whale watching, phase 3. Summer camps, phase 2. Recreational day camps, but you got to follow those guidelines. Phase 3, residential camps, again following the guidelines. Youth sports, possibly some activities, phase 2. Outdoor recreation such as miniature golf, go-karts, batting cages, phase 2. Outdoor, indoor recreation such as indoor batting cages, indoor go-karts, phase 3. Historical sites, to be determined. It's not in phase 1. A comprehensive tourism plan is being developed. Cruise ships is not applicable. They have to operate under federal guidelines. So that's the snapshot on it, and I think that's important. This is all on www.mass.gov/reopening. We will get it on all our websites also. So this is a good guideline here and a path on how we can start to move forward in a safe, healthy way. Thanks for that. Any other questions or comments? I just wanted to get it out because he just made the announcement now. Okay, hey, listen, to everybody, thank you so much. Again, to the media, to the TV media, to the print media, to the radio media, thank you for continuing to get the facts out there. I want to thank all my cabinet heads and rank and file from the bottom of my heart, tested and true, day in and day out. We are not perfect, but we work damn hard to make sure the residents and business community are provided for. And to the residents and business community, thank you for your continued patience and understanding. There is light at the end of the tunnel. We are moving forward. We just want to be sure, cautiously optimistic, that we want to take that one step forward and continued steps, but we don't want to take 2 steps back. So we're balancing opening up our economy and jobs with the importance of medical, health, and science guidelines. To each and every one of you, I hope you have a great week and a great Memorial Day. Don't forget our veterans who gave the ultimate sacrifice. Make sure you honor and remember them in your own way. We will do a City Hall event here. It'll have to be very small, and do the wreath layings at all our Monument Way. And I believe with the Veterans Director Tom Belton and Deputy Director Joey DeCaro, there'll also be cemeteries that we normally flag, which would be difficult to do now with the social distancing aspects. Proper wreaths will be laid at the cemetery, whether in front or by the monument. Next week, unless something comes up that's an emergency type aspect, the regularly scheduled press update with Dr. Kerouac, Dr. Roos, and all my cabinet heads, because it's Memorial Day, will be Tuesday, May 26th at 10:15. I believe, Pat Sullivan was nodding his head, I believe we'll be coming back to you with all my cabinet heads for probably a presser or press conference, probably sometime Wednesday, as we fine tune and work off the governor's edict here, and then we'll continue to move forward. To each and every one of you, good health to you and your families, and God bless you all. Thank you so much.